Hi, everybody. Welcome to the Alzheimer's Association's Walk in the Workplace. We are so excited that you're here to learn more about Walk and the Alzheimer's Association. So my name is Erin Lynn, and I'm the director of the Detroit Walk to End Alzheimer's. I have been with the Alzheimer's Association for about 6 months now, and I hold the purple flower. So throughout our program, if you have any questions, please feel free to leave them in the chat or the Q&A, and my colleague Amanda will help answer them. And it looks like we have a fun little prompt in the chat right now. So if you want to leave what your favorite ice cream flavor is, feel free to leave that in the chat so we can get to know each other a little bit. So first, I want to introduce our fearless leader, Jennifer Lepard, CEO of the Alzheimer's Association Michigan chapter.
Hi, this is Jennifer. I am so sorry that I can not be seen at this moment. I'm having one of those days with my computer. Hopefully I'll be on the screen in a minute or so. But I wanted to thank you all so much for making time to join us today. Really excited about Walk this year. Certainly this year has put us all to, forced us all to re-examine how we do things, and we're excited that Walk is going to be still such a vital part of what we're doing in the community this year. I've been with the association for about 7 years, and I am an orange flower, so I am so lucky that I haven't had anyone directly in my family affected by Alzheimer's, but I've had lots of family friends and seen what it does. It has been my great pleasure to work with not only the families that we serve, also the businesses that are engaged with us and their employees. So I look forward to having you all here and look forward to having some good discussion today. So I'm going to turn it over back to Erin.
Thank you so much, Jennifer. So first, I want to talk a little bit more about the Alzheimer's Association. Our mission is to eliminate Alzheimer's disease through the advancement of research to provide and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. Our vision is a world without Alzheimer's. The Walk to End Alzheimer's is the signature event of the Alzheimer's Association, which plays a significant role in helping the association advance its mission. The Alzheimer's Association Michigan chapter is a part of the National Alzheimer's Association. We have 631 Walk to End Alzheimer's events across the nation. In 2019, we had more than 512,000 participants, 64,000 teams, and $97 million raised. And we are so excited about last year's Michigan Walk to End Alzheimer's results, and we are pleased to share that across the state, we had 16,799 participants and 1,805 teams. Our committees brought in $452,731 in sponsorship revenue, and overall, we raised $2,784,067. We are so excited about last year's results, but we are even more excited about what this year will bring. So we understand that this year is quite a unique year, to say the least, but we are still walking. In fact, Walk this year is everywhere. There will be 3 easy components. Opening ceremony will be done virtually. You and your team will be encouraged to walk within your neighborhoods and visit the Promise Gardens, which are going to be drive-through and view only, and the exact locations are going to be announced soon. And so to find the walk that's closest to you, please visit alz.org/walk. Now, I would like to invite our Detroit Walk to End Alzheimer's co-chair to talk about the impact you can make by participating in Walk. Please welcome Melissa Vici.
Hi, thank you so much for having me today. I'm Melissa. The photograph you see, purple hair. This is something I have been doing for the last year to really raise awareness of Alzheimer's disease, and it's been very effective. So my story starts out when I was in my mere 30s, and my dad retired, and he was so excited because I had just had my second baby. And so I had a 3-year-old, I had an infant. My dad retired because he didn't want to miss out on a second of his grandchildren's lives. And symptoms started, and we weren't sure what was going on. I still get emotional about it. Dad was diagnosed with mild cognitive impairment. We did not know at that time that that turns into Alzheimer's disease. Mild cognitive impairment sounds tiny. It sounds like no big deal. It sounds like something that we can get fixed right away. It certainly wasn't. Over the course of 10 years, my dad progressively lost his ability to remember the simplest items as a lawnmower, the lawn, a glass of water, his favorite meal. Then he started forgetting about us, and then he started forgetting about my mom, and he started losing his ability to walk, to talk, and really take care of himself. And that's what really brought me to the association. My dad passed away 5 years ago after a 10 plus year battle with the disease. I carry the purple flower. I've been volunteering with the Alzheimer's disease pretty much a couple months after he passed away. I didn't know what to do. I didn't know where to turn. I called the 800 number, and that led me to becoming an advocate and traveling to DC. After my first year, I got involved in walk. After, actually, after my first year on the walk committee, while I was still just super excited about how impactful the walk is, I had lunch with the staff and the chair, and they asked me to come on as co-chair. And I've been doing that. This is my third year being a Detroit co-chair for the walk. And I can tell you it has been the most impactful experience I've had in a long time. It has really helped me help provide more of an understanding to my team members at work. You can see I work for United Shore. I work with 6,800 team members. They support my purple hair. I walk around. People actually will come up to me and say, Melissa, I was told I should talk to you because my aunt was just diagnosed with Alzheimer's disease. Or, hey, why aren't you wearing purple today? I mean, everybody knows me at work. Even our CEO is like, hey, what's going on with Alzheimer's disease? What can you tell me? How can I support? So this has been incredibly, I hate to say fun, but it's been fun because I'm able to get more and more team members involved. So before we start getting into all the fun things that we have planned for Walk Day, I think it's really important that we talk about the urgent need to end global Alzheimer's disease epidemic. To do that, we have a short video that we'd like to share. So how many of you were shocked at some of the statistics in the video? Utilize the share and put something in the chat and let us know what you've learned today, what you learned from that video. I really think the end of the video, what we're showing, sums it all up. The Alzheimer's Association is leading the fight, but we need your help. We need your support today more than ever. Okay. So in addition to all of those eye-opening facts and figures, the Alzheimer's has a big impact on the workplace. I'm sure some of you already know this. If you can just picture yourself in your office, sitting at your desk, picture your team members around you, and imagine how many of them have lives outside of the office that you're not aware of. Imagine how many of them are managing this disease. When you look at this statistic, 6 in 10 caregivers were employed in the past year. So that's 6 in 10. Think about all of those team members around you, your managers, your supervisors, everybody. This affects so many people. These individuals that are caregivers, they're still working an average of 35 hours per week while caregiving. The statistic below it completely hits home with me. 57% of the employed caregivers have to go in early, they have to go in late, they have to take time off. They have so many caregiving demands. I work in project management in IT. I have a very high demand position, and I've been in this high demand position for the last 17 years, which means as my dad went through his Alzheimer's disease, and I was a young career mom going through this journey with him, I was employed. And I would receive phone calls from my mom while I was at work, sometimes when I was on a meeting, sometimes when I was facilitating a meeting, that dad wandered out, or dad ate raw chicken from the refrigerator, or he ate seashells, and I don't know what to do next. My mom, being a primary caregiver, took on a lot, and it was high stress, high demand. There's no playbook for Alzheimer's disease. Absolutely no playbook. So being that secondary caregiver, I had to leave work a lot. I had to come in late. I had to leave early for neurology appointments, for many, many doctor's appointments, and also to help care for my dad. My dad stayed at home for as long as he could. The last 2 years of his life, he was in a nursing home, and even that had a lot of days where I had to leave midday to run up to the nursing home. Many days where I had to leave and go help my mom make new decisions, sit down with, if a psychiatrist came to the nursing home at 3 o'clock in the afternoon, I had to be there. I had to be there to answer questions. A lot of people did not know at work what I was going through. I tried to keep it very secretive. But I was 33 years old when I became a guardian for my father. And I was in my early 40s when I had to help make decisions with hospice. That's a lot to take on as somebody, young and in the workforce, and then trying to help my employer understand what I was going through. Because again, I tried to hide it for a very long time. So if we go to the next slide, there's a couple more statistics that I'd really like to share with you today. There we go. Continues to be the impact, and it's the middle statistic. 83% of care at home is provided by family members, friends, or other unpaid caregivers. If you could please look at both statistics that are in between, you'll get a better grasp for what we're going through when we do walk through the journey of Alzheimer's disease. 83% of that care is provided by friends and family. It is, for our family, it was my mom the majority of the time. As soon as I got off of work, it was me. On the weekends, it was split between my sister and I. And then when it got really difficult and dad needed 24-hour care, we brought in caregivers that it was favors. It was a lot of favors, and there was a lot of vacation time taken off, and there were a lot of discussion of reduced work hours. to help with dad's care. And this is the reality of what a lot of us go through as we're working through managing the disease and managing symptoms. And that's why it's so critical that we have more corporate sponsorship, that we have more employees of corporations working together so that we can really help come together as communities and end this disease. So I want to thank the Alzheimer's Association for yet again giving me a platform to talk to everybody about the disease. And I really hope that you can get excited and that you can start helping us end Alzheimer's disease. Now, I'd like to introduce to you David Hoppy. He is the financial advisor for Edward Jones. He also is the Calhoun County Walk to End Alzheimer's committee member. So he's going to talk to you a little bit more about his involvement.
Okay. Thanks, Melissa. I assume everybody can hear me. I was not able to get on TV, but I was always told I had a face for the phone or radio anyway. So if you look at my picture, I've lost 50 pounds, so I need to get that picture taken care of as well. But I want to thank you for the opportunity to share a little bit how we at Edward Jones are engaged with the Alzheimer's Association, a little bit on the why on that coming up. But personally, as I'm sitting here listening to Melissa's story, I'm going, yeah, and it's not something that hits all of a sudden. I mean, you can have a heart attack and die immediately. There are so many other ways that you can pass away and not go through this awful scenario with dementia or Alzheimer's. And a little bit on my story, my mom died of Alzheimer's, and it goes back to 1984 when my brother died unexpectedly at the age of 37. She was 64 years old at the time. Your children aren't supposed to die before you do. She had just recently retired, and this really threw her for a loop, and she never really recovered. And for a number of years, at that time, Alzheimer's was just kind of, it was just a word that was out there. There wasn't anything that was going on. So my dad, my brothers and sisters and I, we were all trying to figure out what was going on. She was in a very deep depression, took her to a lot of doctors, a lot of psychologists, psychiatrists, our medical doctors, tried a lot of different medicines over a number of years. And from about 1984, 85, all the way out to 1993 now, that 9-year period, my dad was really, at wit's end. He was still working, and so, we as a family were, helping out in those situations. She wasn't really in a full dementia stage, but she was just very agitated and depressed. They went to Cleveland Clinic in 1993, sat down with a doctor, and the whole appointment went 15 minutes as he looked over the records, and he said, this is a classic case of Alzheimer's disease, dementia. And this was in 1993. Still, again, it was relatively new. They didn't know what that meant until the doctor explained them, and of course you can expect at that point it really hit him very hard. For the next 3 years, my dad was the caregiver. He had at that time retired, and he was 24/7 taking care of her, and we would give him some time as well. 1996, it got to the point where, the only way she knew him was that nice man sitting in the other room who gave me these rings. And, she was talking about her wedding ring. She didn't even know who he was, didn't know his name, didn't know, virtually anything. And at that point, my dad was 24/7, and she was up in the middle of the night, walking all over the place, wanting to go home. He would take her in the middle of the night for a ride around the corner and take her home, and that would last for about an hour and a half, and it just didn't work. Ended up in a nursing home for 6.5 years. When in 1996, passed away in 2002. One of the hard parts for us was that my mom and dad were not wealthy people. I mean, they were they raised a family of 5. They after the kids all left, they had some money saved, set aside, and then we had to help him become legally poor so that he could go to Medicaid and ask the government for help, which was very, very demoralizing for my dad to do that. He never wanted to do anything like that, but that's where we were. So she died in 2002. And, I tried to get engaged a little bit. And then with Edward Jones, moving forward now to 2016, I've been very active since Edward Jones came on board. And as we all know, this year is a little bit different in how we're going to go about the walks. And it's our 5th year of the alliance with Alzheimer's, and really, despite what's going on, these are exciting times for us in our engagement. 2016, we made a commitment of $12.5 million. We created the Edward Jones Alzheimer's Research Fund. We were the first national sponsor of the Walk to End Alzheimer's, and since that time, we've had over 65,000 Edward Jones associates nationwide participate in over 630 walks. And on top of that, we've raised over $25 million in those walks. Well, and maybe you know this and maybe you don't, we've renewed our pledge to Alzheimer's with the Research Fund, another $25 million commitment over the next 5 years. And we had that announcement here a couple of weeks ago in a national broadcast to all of our associates nationwide with our managing partner, Penny Pennington, and your president and CEO, Harry Johns, combining together to talk about the goal and the commitment and the relationship that Edward Jones has and will continue to have with the Alzheimer's Association. And of course, the goal is to be living in a world without this dreaded disease, and we all want to get to that point. And we all know that Alzheimer's didn't stop because of COVID. As a matter of fact, it's brought it to the forefront even more so in terms of awareness. So we're all engaged and moving forward in a positive way. Why is Edward Jones engaged? What brought us to the table in this regard? Again, just maybe a little history for those of you that don't know who Edward Jones. We are not a publicly traded company. We are a partnership, and so each office is set up independently. We have over 15,000 offices nationwide. And one of the things that, is one of our core values is that we get engaged and involved in the communities in which we live. And so that is very vitally important to what we do. We have, the community involvement on a local level. And we have in our region, Region 220, we have 3 separate walks. And Amanda Binger is very vital in helping us getting that set up and working with us in those areas. So I want to give her a shout out as well. She's just done a phenomenal job with us. And again, I'm preaching to the choir on this. 5 million Americans are with this disease. We feel that about 150,000 Edward Jones clients nationwide are dealing with this. We are in the business to help our clients preserve their wealth. We work with clients over a long period of time, helping them identify goals, save for those goals, live for those goals, and then be able to pass on what they can. A lot of clients, and I have some now that I'm working with. I've been doing this for 27 years. Are dealing with Alzheimer's, have passed away from it. They're taking life savings to take care of the needs at home or in facilities. And again, what I heard Melissa saying, her family, these are the unpaid caregivers. These are the ones that are really on the front line. So it's very devastating to deal with this, as we all know. But Edward Jones is committed as a firm in the communities in which we live and serve to help be a vital part of finding a cure. So I consider it an honor and a privilege to be associated with a firm and with the Alzheimer's Association in getting this walk taken care of this year. So thank you for the time. I want to pass it on right now to Kirsten Shiner. Kirsten's with Jackson National, which is a sponsor for the Lansing Walk to End Alzheimer's. She couldn't be with us today, but she wanted to share why they sponsor the Walk to End Alzheimer's.
Hi there, my name is Kirsten Shiner, Senior Corporate Philanthropy Specialist at Jackson National Life Insurance Company. I've been involved with the Walk to End Alzheimer's since 2015 when I started with Jackson, but have since lost 2 loved ones to the disease. At Jackson, we're proud to support organizations that support strong families and increase economic opportunities in the communities where we live and work, which is why we're involved with the Walk every year. The Alzheimer's Association does so much to find a cure for Alzheimer's disease, which is why I invite you to join us in supporting, donating, or walking in this year's Walk to End Alzheimer's.
Thank you so much to Dave and Kirsten for sharing your stories, and thank you so much for supporting the Walk to End Alzheimer's. So today we've heard a lot about what we do and how other companies are involved. So you might be thinking, what can I do to help my employees or my coworkers? Well, we are here for you, your employees and coworkers. We can provide virtual lunch and learns to your employees, and we also have virtual support groups and educational programs. If you're interested in any of these programs, please be sure to complete the survey that will be emailed to you after this event. With Alzheimer's diagnosis on the rise and the challenges presented from COVID-19, this is an extremely difficult time for not only those with the disease, but also other caregivers and supporters too. So please know that the Alzheimer's Association is here for you through our 24/7 helpline. You can also find additional resources on our website and guidance specifically related to COVID-19 at alz.org/COVID-19. We just talked a lot about what Walk to End Alzheimer's is, so now let's talk about the why. This is a great opportunity to boost employee engagement, all while creating a positive presence in our community. By partnering with Walk to End Alzheimer's, it shows your community cares, a company cares about being part of the solution to one day have a world without Alzheimer's. So how you can help, you can be a part of this movement to end Alzheimer's by starting a team with your colleagues for the Walk to End Alzheimer's nearest you. So again, you can go to alz.org/walk to find that walk that's nearest you. You can host a casual for a cause day, or if you're working remotely like many of us, you can do a Wear Purple on Zoom day where everybody wears purple that day to raise funds and awareness for Alzheimer's. We also have a variety of amazing sponsorship opportunities at all of our 24 walks across the state. This year more than ever, we need you. So please take a few minutes to register for Walk at alz.org/walk, or you can text ALZWalk to 51555. You will also receive a survey after this event by email, so please help us and complete the survey. This will help us work on these events for the future and also get the right information out to you. So I want to thank you so much for attending Walk in the Workplace. With your help, one day we will live in a world without Alzheimer's. If you have any additional questions, please feel free to reach out to the walk manager nearest you, and please take the survey. So thank you so much for your time, everybody. Be safe and stay well.